I think this pandemic has cast a spotlight on public health across the world like never before, with around 5 million deaths, at least official deaths, and 250 million people infected. And the speed at which the virus spread across the globe caught the world completely off guard, placing unprecedented pressure on health systems, exposing weaknesses, causing major disruptions, even in some of the wealthiest and most well-resourced countries. This is in itself a wake-up call, I think the most powerful wake-up call, to look at the issue of public health in an integrated manner, also in the developed world, and also, of course, globally. We need governments all over the world to understand that they need to create more resilient health systems, and they have to use this opportunity, as I now saying very often, if not now, when? But while there is always room for improvement, we need also to stop and think first about what we can, where we can achieve the greatest and most cost-effective gains, particularly given the economic fallout from this pandemic. What can we do? Is just to prepare emergency rooms for the next pandemic, is just to invest in better access in some areas. The most honest answer is that we don't know yet well, because the fact remains there is a lot of unknowns. There is no guarantee that the next virus won't be more virulent and place health systems under even greater pressure. So no matter what resources we throw at our public health infrastructure, it may not prove to be enough. When COVID-19 first struck, some countries, particularly in the Asia-Pacific region, had some experience of dealing with novel coronaviruses, and many other governments looked to them for how to shape their own response. In some cases, this proved extremely effective at reducing the immediate impacts and kept COVID-19 at bay, but the insidious nature of this virus has meant that in the long run, no country has been left unaffected. What all this points to is the fact that the best way to enhance resilience in public health and health systems against the threats of pandemics is, first of all, it's obvious, to prevent pandemics. The fact is that, although far from perfect, most health systems in the developed world are, relatively accessible, effective, and sustainable, but they were not able to cope with this situation. So perhaps ironically, the best way to make them more resilient is to improve public health and make health systems more resilient elsewhere, particularly in the poorest parts of the world. Doing so will not only improve our ability to detect novel and potential dangerous pathogens more quickly, but it will also help to reduce the chances of outbreaks turning into epidemics and escalating to become pandemics. We cannot prevent novel infectious diseases from emerging, but that does not mean pandemics are inevitable. In fact, they can be prevented if there is enough planning. That's why it's so important and so primary health care. Primary health care is usually the first point of contact people have with health systems when they get sick. They are our first line of defense. In terms of detecting emerging infectious diseases, we have to pay attention to those communities that are more exposed, because they are usually the blind spots, because they are people with limited access to clean water and sanitation, usually living closest to undomesticated animals, from which new infections so often emerge. So even before COVID-19, the picture was grim. According to the UN, around 60 million lives could be saved by increasing spending on primary health care in low and middle income countries by $200 billion US dollars per year. And COVID has only made the situation worse, amplifying such pre-existing global health inequities. Just one look at the state of global COVID-19 vaccine distribution says it all. While around 70% of people in high-income countries have now been vaccinated, in low-income countries, we can speak about around 3%. This is not only morally wrong, but it is also short-sighted, as it will only serve to prolong the pandemic, which ultimately helps no one. My organization, Gavi, the Vaccine Alliance, has been working hard to address such inequities, both before and during the pandemic. Prior to COVID, Gavi helped vaccinate around half the world's children, and since 2000 has protected more than 888 million children from a range of deadly and debilitating infectious diseases. And now Gavi has been at the center of the pandemic response as a co-leader of COVAX, the global initiative to make COVID-19 vaccines equitable, available to people in all corners of the world, regardless of income. So far, we have delivered more than 409 million doses to people in 145 economies, the majority lower income countries. By the end of the year, my management tells me that they will be able to allocate, probably not yet to deliver, but at least to allocate 1.4 billion doses. But we could have done much more if there was not some behavior that was not the proper one, I think, from some governments or manufacturers. That's reality, because we found ourselves at some moments with money, but without sufficient doses, because there were export restrictions, because there were also, there was excessive accumulation of vaccines in some countries. So I believe now it's the time to look at these failures also, but also at the possibilities opened by this experience. As you know, there will be the G20 at the end of this month. I think that should be an occasion to look at this matter, not only in terms of the response, the continuation to the response to this pandemic, because it's not yet over, but also future pandemic preparedness, and also looking at it holistically in terms of health resilience. This is the message I wanted to share with you at the beginning of our panel. Thank you for your attention.